So this was sort of a culmination of a couple things that sort of happened in our lives, passing of a close family member, and being confronted with your own mortality in a very close way, and sort of reconsidering, but based also on how this person lived their lives. So also with our oldest, who was already 18 years old, leaving the house, we sort of felt like, whoa, it goes by so quick and they're so precious. So what do we want to reconsider? And, since we started, we got married young, we started having children young. So it's sort of a culmination of all those facts that we looked at each other. It's like, you know what? Let's make our family just a little bit bigger.
A vasectomy reversal is essentially reversing the process of having had a vasectomy. When a man has a vasectomy, essentially what that means is that the pipeline of sperm transition or transit has been cut off. And therefore, what I tell men is that your factory's still making sperm. We've simply cut off the highway or the pipeline of transmitting sperm into the urinary tract.
The main thing for us that we wanted to accomplish is to have the highest success rate with the minimal amount of actual risk. And so thinking through that, we obviously we realized there was going to be an operation involved, but understanding how involved that is, right, and what the recovery time looks like. So those were sort of important things that we're thinking about.
A vas reversal or a vasectomy reversal is a very intricate, very delicate operation. This kind of surgical skill requires the use of a high-powered microscope, as well as sutures that are not visible to the naked eye. And therefore, what that means is that it does require specialized training in the form of a fellowship, typically. A vasectomy reversal, unlike your vasectomy, takes nearly 3 hours. And that's because we do a complex repair, bringing your vas tubes back together through a 3-layered operation with sutures that are very, very tiny.
While doing research online, it became pretty obvious that there are quite a few places that do it, but they do relatively high volume, and their techniques are not as sophisticated as you'd like. So pretty quickly we started to see, okay, there's a huge difference. You can't just Google, reverse vasectomy, find the place closest to you, and boom, they're all going to be the same, right? That's not the case.
The reason to see a specialist is an important one. Here at Georgia Urology, myself and a few of my colleagues specialize in male fertility care, which means that we have gone through the appropriate training, not just through residency, but often through fellowships in male infertility that provide us the skill set in order to offer you the entire menu of options that are available to you. We perform this procedure in the right way every single time, which is why it takes the time that it takes and the diligence that it takes to do the job the right way.
Yeah, I'd say there wasn't really pain, so I didn't really use pain medication sort of after the first day, because first day you're sort of like, oh, how's this going to feel? Because certainly your private area is certainly swollen. So you're sort of like, oh, that's got to hurt. But it really wasn't that painful.
In terms of recovery, after your vasectomy reversal, I expect that you'll be sore and bruised and a little bit swollen for about 5 days. I tell men this is a little bit more than your vasectomy. It typically means that by the following week, you are returning to normal activity. And generally, we require that you do not engage in sexual activity for 2 to 3 weeks after your vasectomy reversal. In terms of heavy physical activity, I tell men about 3 weeks is considered normal time.
It was tender, and you just had to take it easy. So good thing I have a desk job, so it's relatively easy to get the laptop and work already a little bit the next day.
In terms of pain after your vasectomy reversal, as I mentioned, it might be a little bit more than your vasectomy, but generally I ask patients to take Tylenol, ibuprofen around the clock, and icing. That tends to take care of most of the pain for most of my patients. Now, some men will require a low-dose opioid medication like an oxycodone for a few days. Now, the timing from vasectomy reversal to success in terms of causing pregnancy can be quite variable. In terms of testing and success, I typically perform a semen analysis at the 2 to 3 month mark after a vasectomy reversal. In situations where you've had a straight connection, it could take up to 6 months to restore sperm in the system. In situations where you've had a bypass procedure, it can take nearly a full year before sperm is seen in the system.
So then recovery for a week ish. And then, my wife had her last pregnancy at the end, let's just say at the end of November. And sort of at the end of December, we knew when her period was, but she didn't have it. So I was like, well, could it be? So we got a pregnancy test, and lo and behold, so from December 5th to New Year's Day, that was the operation on December 5th, finding out that we were pregnant on New Year's Day. That's sort of how quickly it was.
The journey of infertility is an important one and very near and dear to my heart. And having gone through the training and having seen people have the successes that they've had, it just brings a different kind of joy.
Incredibly satisfied. I would recommend it to anybody who is potentially, is considering this. I would say that this is the way to go if you want to ensure that the process is smooth, comfortable, recovery is good, and you want a highest probability of success. I couldn't recommend, and I wouldn't change anything.
Medical care is different in every way, and different doctors have different gratification in the kind of treatments they do. But for me personally, being able to bring joy to families in the form of having children is one that's very, very special.
We're very lucky to have met Dr. Kapadia and have his expertise, because without him, this specialization, this wouldn't be possible. So he makes a lot of families really happy, I'm sure.